Good morning. Ako si Alan Domingo at magkauban karon si Dr. Karen Gaudor sa PHA Cebu chapter ug si Dr. Luigi Segundo ang PHA Director 3 at the same time Advocacy Committee Chair. Okay, good morning.
Good morning.
Good morning.
Okay, first before ta sa inyong activity karong Sunday, mangutana lang ko, Doc, with regards to kanabitang common kay nga problema karon sa kasing-kasing, dili ingon problema sa kanang gugma ha, but physical nga sakit sa kasing-kasing. Can you discuss to us with this problem? Si Doc Gaudor first.
Okay. So ang i-discuss gyud karon is coronary artery disease.
Yeah.
No, so mo ni siya ang naibara ang blood vessel nga mo supply og dugo sa imong heart. So daghang pwedeng mo block anay mong artery, no? So mga plaka na sila sir, cholesterol, sugar ug history of smoking nimo.
Okay.
Kung hindi untreated man gud na imong coronary artery disease, muhatag na nimo og simptomas. Mo ni siya ang classical kinahanglan kita tanan makahibaw unsa ni siya. Mo ni siya ang chest pain or angina,
Okay.
huot sa dughan. Mo na siya ang among point diri is awareness sa tanan about anang naay simptomas nga huot sa dughan nga mukuan mo appear siya kung mahago ka unya mo okay siya ug mo pahuway ka mo na siya classic na angina.
Angina meaning kanang pagpanghuot sa dugan. It's a
Kana,
medical
medical term angina.
Okay, so karon pa ko kabaw patuloy. Angina.
Angina.
Kaning angina, unsay mga symptoms, manifestation nga naa di ay ingon niini nga sakit.
Oo. Yung pain po kasi, that can be subjective, no? You explain it in the vernacular, but the truth is, the patient is not aware it's the symptom, no? So the main clue there, if it's triggered by physical activity, meaning it can be pain, it can be heaviness, it can be shortness of breathing. So when you start walking up the stairs, or anything that increases your heart rate, sometimes emotional excitement, when you sense that your heartbeat is fast, and then you feel the discomfort. Again, the most common is heaviness. It spreads on the arm, or shortness of breathing, hingat. And then when you stop to rest, it disappears, then probably angina, and you need to see your doctor.
Okay, so kung maka-experience ta ni ana kinahanglan konsulta sa doktor, dili ingon nga iunya-unya kay basin og stress lang ni kapoy lang.
No.
Yes.
No.
Kinahanglan gyud para ma-screening ta sir. Mo na siya ang point sa screening, no? Screening is bisan ang pag-BP sa imuha sir, screening man na siya. And then one ECG, and then ang pagstorya nimo sa imong doktor sa imong simptomas, makakuha naman pud mi nga okay, angina ni siya ug dili laing butang.
Diri ko sa triggering factor, unsa man mga factor nga maka-trigger ni ining angina.
Okay. Daghang maka-trigger anang angina sir. Ang angina is ang chest pain, no? Ngayon pasabot. So, exertion. Number 1 yun siya nga kung mahago ka, then the blood supply to the heart will lessen, no? So, mo na siya ang one trigger. Next is kung imong BP taas kaayo, uncontrolled kayo for that moment, then it can cause you chest pain. Sa paman. Mora man siguro.
So kung dili ni siya ma-address dayon, mas mo resulta ni siya mas severe problem sa heart. Unsay mga common severe problems when it comes to heart?
Describe the heart attack.
Okay. No, kay kani siya bara man atong gikuan ani sir, no, angina raman ni siya. So ang severe nga you're asking about now is heart attack. We don't like heart attack because heart attack can be fatal, no? Swerte itong uban sir nga heart attack that can be treated medically lang, no? Kung moadto pud sa hospital. But some heart attacks do give you pulseless, no? Mamatay ka dayon at that moment, massive heart attack. So we don't like nga mo move ka from that stage nga bara lang unta. Nga wala pa mo heart attack, meaning the muscle of your heart bisan minus ang blood flow is still okay. Ang pasabot sa heart attack is with that limited blood flow, the muscle of the heart now na kuan na siya, naigo na siya, na affected na hinuon ang muscle mo na siyang heart attack.
Okay, kaning heart attack o cardiac arrest, the same ba ni or two separate?
Sige.
Maganda. All right. But going back to angina, maybe the message there is you don't ignore it. No? First time you feel it, maybe I'll see the doctor next week na lang. Tomorrow, I'll get an appointment. You feel it again, and then you feel it again, and you start getting used to it. No? And you ignore it. And then later on, it becomes more severe. When we say severe, you asked about it. No? That means before, second floor, that's the time you feel the pain. Now, halfway first floor, masakit na. No? Or 10 minutes, you rest, wala na, gone na. But now 10 minutes, it's still there. Maybe that's heart attack already. So maybe you don't go to the clinic. You go to the emergency room if you're unsure. No? If you're unsure. Now, when you asked about difference of cardiac arrest po at saka yung heart attack,
Yes.
no? The most common cause of cardiac arrest is heart attack. And when you say cardiac arrest, the heart is beating this way normally. Cardiac arrest, that means either the heart stopped beating, flatline, ECG flatline, or the heart is not beating properly. We call it ventricular fibrillation. Nisay, we call it, no? Ventricular fibrillation. There are a lot of things that can cause it. The number one is heart attack.
Okay.
Other causes related to abnormal heart anatomy. For example, somebody born with heart defects. If it's not fixed, it can go to cardiac arrest. Sometimes other diseases can affect the heart and cause cardiac arrest. It's just that the heart attack is most common.
Cardiac arrest is more fatal.
Yes.
Pero maka-survive maghapon?
Pwede if mag-CPR.
Yeah, CPR.
So we advocate if you come to the event on Sunday, we will teach lay CPR. The idea there is all Filipinos, all able-bodied Filipinos, in fact, even children, worldwide, the youngest documented rescuer is 11 years old.
Yeah.
Because they were taught to do CPR in school.
The basic.
The basic, no? The idea there, maybe an 11-year-old right now will not be able to perform it properly, but if this child remembers and this child grows into adult and has been trained, in the future, he can be a rescuer. Because the instinct right now is you witness an arrest. What can be an arrest? You see a man standing, walking, and then falls, and then you can't awaken the patient. Now, maybe it's an arrest. No? So if you're trained to do CPR, the first thing that you do the chest compression. No? And if there, of course, you call other people because you don't stop chest compression until the medical people arrives. No, ideally, you don't just observe and call the ambulance and wait. Ideally, you do chest compression until the patient is sent to the hospital.
Kailangan naman yung basic sa patient kung maka-experience o mga heart attack.
Until maabot ang experts, kinahanglan na atay gibuhat, wala lang bitaw nato tutuka ang pasyente.
So ito na i-discuss later on. Like, dako sa mga common cause nga makamugna o heart disease.
Risk factors?
Risk factors ang paano mo, sir, no? So, naatay daghan, no? High blood, no? Hypertension, diabetes, no? Increased blood sugar, smoking, sir. Onya, physical inactivity, so kanang walay exercise. Kana siya.
Kasingot yun.
Cholesterol, dyslipidemia, kana siya.
So, mo-complicate siya. That would be
Unay
so.
makaamot sa katong coronary artery disease.
Piling atong heart disease, also man siya number one leading cause of death.
That's it.
Nation.
Yes.
Correct.
We have that
Just for the
data.
record.
Correct.
Philippine Statistics Authority, if you look at 2022 data, the number one, it says there's ischemic heart disease. It's the same as coronary artery disease. That means there's no oxygen supply in the heart related to blocked artery, coronary artery disease. That's the same worldwide.
Pila ang edad sa kinabataan nga nagka-heart disease?
Wala tayo ko there's no study
Local.
for that, no local study for that, but as per clinical experience, there are patients in their 20s already nga establisher na diagnose na ni nato established coronary artery disease niagi na pud sila og treatment, no?
So, kaning 20s, mas bata ni siya based sa inyong experience compared sa mga nanglabay katuigan.
Yeah, definitely younger, no? But these young patients also, naasan sila katong mga risko nga atong giingon ganina. Di lang pud ingon nga, healthy man kaadgid kaayo ni siya. Look closely, di ba? Overweight na, cholesterol ana taas kaayo, ang papa ana na bypass di ay. No, kanang these are the things nga risk factors lang siya, but it doesn't mean na abi 20 lang siya, 28. Dili na to classic ang iyang gibati nga chest discomfort. I'm sure na to siya chest discomfort yun when he started out.
Unsa man ni siya kanang sa lifestyle? Unsa yung factor ngano nagkabata agad tunay ini nga problema?
Agree sir, no? So lifestyle changes gyud nato recently, no?
Dietary.
Especially ni agi tag pandemic, sir, no? So mas di na gyud kayo nagka-sedentary na gyud ang people. Now I think we're catching up now, no? Na natay mga face to face. Diet also, sir, no? Diet also niya. Kaya nga ako amangod ba? Easy magug kaayo ang prepared foods, no?
Yung instant.
Processed
Instant
food.
foods. The processed foods that we eat in the morning, no, bisag dili pa na siya canned goods. Putang tag the bacon, hot dog, hams. No, these are processed foods. So remember na ana sila salt intake o salt nga ng taas nga salt content. So kana lang daan sir sa lifestyle gyud ta.
Hereditary ba niya heart disease?
Okay, it can be hereditary ang heart disease, pero kaning coronary artery disease in particular, acquired ni siya. No? So, mao na siyang nanatay risk factors para naa kay coronary artery disease.
Okay, sa mga himuon na to, makalikay ta sa mga sakit sa kasing-kasing.
How to modifiable.
Hypertension?
Yeah.
Okay. So high blood pressure, you don't feel it. Na? The common misconception, only if you have nape pain, then maybe high blood pressure. That's not true. A lot of, remember in depression, we have studies showing a lot of patients who are actually hypertensive are not aware because you don't feel it. The only way of knowing if you have high blood pressure is to measure
To get your
Blood pressure.
blood pressure. You don't do it on your own. You do it. No, you have a blood pressure monitor. Clinics will have blood pressure monitor. There are home blood pressure monitors, but you have to learn how to take them properly. No, teach you that. Cholesterol, we talked about that. You don't feel high cholesterol. No, it's not just one food. It's cumulative over time. No? So what you avoid is red meat, fatty food, animal-based oils, no? Smoking. We talked about smoking.
Issue.
Bisyo, 20% smokers in the Philippines, no? Alcohol intake, excessive alcohol intake, more than 2 drinks a day in men, more than 1 drink in women, that can lead to high blood pressure as well. No, physical inactivity. Ideally, you do physical activity. Does not have to be in the gym. Choose to walk. No, climb up the stairs if you're healthy enough to do that 1 hour a day. That's good enough. That leads to obesity if you're not physically active. No, and obesity also tied up with diabetes or high blood sugar. So if you take in a lot of sweet, especially the drinks, the more convenient to get is the sugary drinks that can lead to diabetes as well, especially if you have the family history. We call it modifiable. No, we can manage that so you don't have a heart attack.
Like, I forgot to ask, do you know what the statistics as how many like sa Philippines namatay because of heart attack or cardiac arrest, heart-related disease?
That's the I go back. Ischemic heart disease, number 1. I think the percentage. All right, there you go. In 120,000 in 2021, and this is just as of October 2022, nearing about 70,000 with ischemic heart disease as the listed cause of mortality.
121,000 sa 2021 and 70,000 sa 2022.
As of October.
As of October.
As of October. October 2022, because that was the last time the Philippine Statistic Authority has finished the data
So
gathering.
just for the record, nangamatay na.
Matay na. This is mortality.
Yes.
Mortality, yes.
Okay. By the way, nata sa opisina karon ni Consul Joel Garganera atong ipahigayon atong interview. Cons na sila sa panglayo. Thank you. And sa paggamit sa imuhang Panday Cafe. Anyway, darita sa kuan padayon ta mga kapuso, no. And doon na tayo, kuan tayo, kalihukan karong Domingo, ang Philippine Heart Association, kay karong buwan sa Pebrero, buwan manisgugma. And Doc, unsay mga activity, unsay kalihukan nato siguro nga ato ang kinahanglan nga tampungan karong Domingo.
So kanitanan atong gistoryaan sir, ato ning ibalik or atong i-emphasize again on Sunday. Kay on Sunday is the Heart Month celebration. Philippine Heart Month. So national ni siya nga activity, pero ang Cebu mo'y nangusog no for this year.
Ngano ang Cebu man?
Kay diri lang nila gipili kay 50th nila sir. So
Special ang
most
Cebu.
special ang Cebu.
Cebu
So
City.
ang chapter nga ilang gi-choose is kita jud. Kita jud mo celebrate no. So I think they also have high hopes for us no. Makita mo mo lead ani in the country of the prevention. So Heart Month celebration this Sunday. This is February 26, February 26, 2023, Sunday at SM Seaside, Cebu at the City Wing. No, mag-start ang activity sir 7 a.m. We'll start with a mass. Bring your families. Anya magsugod na dayon ta the whole morning. No, we have several activities in line up for you guys. Naatay screening. So naay mga doctors dito, mag-line up mo, suti mo sa inyong mga problema. Sa heart ha, nga problema.
So consultation.
Consultation ni siya, mag-ipitan ninyo, mag-vital signs mi ninyo, naapod kay free, cholesterol o blood sugar determination, naapod kay free ECG o ABI nga test sa mga kandidato.
Okay.
Unya, ang most important, yung murag ang ato yung advocacy po here is mo teach me og CPR. To
Basic.
everybody nga makaagi dito, no? So there's no age limit for teaching somebody with CPR. No need to bring anything.
Walk in.
No, walk in lang yun siya. No registration fee, just come visit us. Join us.
Okay, Doc. Ito na kayo madugang
Last.
before to sa last
Yeah.
session.
Previously, all Heart Month activities they were done Metro Manila. The first time that the Heart Month was celebrated out of Metro Manila was in 2014. First time Cebu. So we're going back to Cebu again. You know, the past pandemic, we haven't been doing it face to face. The first time we're doing it face to face, Cebu again. So thank you Cebu City for hosting the National Heart Month this Sunday.
Okay, one last day. Kato ko pangutana, ang broken heart ba maka-cause of heart attack?
Pwede gina siya sir, no? Naamang tayo gitawag og broken heart syndrome, no? Nga mimic jud siya og heart attack jud. Pero on follow up na kanang work up nami, walay bara. Walay bara pag angioplasty, wala na siya bara. Pero it's a thing, sir.
Syndrome.
Syndrome yun.
Non-stress.
Tungkol sa emotional stress.
Yeah.
Okay.
Trigger niya.
I see. Okay, salamat kayo no, ni Dr. Karen Gaudor sa Philippine Heart Association, Cebu Chapter, and Dr. Luigi Segundo sa Advocacy Committee Chair and PHA Director 3. Thank you so much. Okay, mga kaposo, so magkita ta sa Domingo dito sa Seaside. Okay? Ako si Alan Domingo, magkita ta sa Balitang Bisdak alas 5, just hantod sa alas 5:40 sa hapon, Monday to Friday. And daghang salamat kanatong tanan maayo.